Ready? Okay. So we did our project on cardiomyopathy. It's actually pretty rare out of all the heart diseases, but we just decided to do it. So it's a heart disease, or it's a disease of the myocardium, which is the heart muscle, and it literally translates into heart muscle disease. We're talking about the three main types, which is hypertrophic, and that's when the ventricular wall becomes thickened. The dilated, which is the left ventricular chamber, becomes enlarged, and restrictive, which is the ventricular walls become rigid and stiff. So I'm going to talk about the hypertrophic cardiomyopathy. It's just when the septum, or the interventricular septum, which is the muscle in between, that becomes significantly thickened to a point where the left chamber, or the left ventricular chamber, is small. So this right here becomes really thick, so this area right here becomes really small. Yeah. So yeah, I just wrote that in parentheses just to make that simpler. So this is what the picture looks like. On the left is a normal part, and you can see that middle wall is fine, and right here is where the wall is thickened, so this area is a lot smaller, and those are your valves right there. So cardiomyopathy, like I said, is not very common when it comes to heart diseases. However, hypertrophic became really well known because it accounted for more than 33% of sudden death in athletes. And the muscle becomes so enlarged that it prohibits the flow of blood into the aorta, which is obstruction to outflow of the left ventricle. And this, it's not limited to ages from 12 to 36, but that's where it normally occurs. And 1 to 3.6% of the people with HCM die every year. It doesn't seem like a lot. However, most of it is sudden death, so it's just kind of death out of nowhere, which is a lot. And then I also have a video at the bottom. It's kind of depressing, but yeah.
DJ from a young age was athletic. On October 31st, 2006, what started out as a normal day ended up being the worst day of my life. He went to the first basketball practice of the season and collapsed and died. This is a picture of DJ shooting a free throw.
When Billy Stahlschmidt's 15-year-old son DJ died in 2006, he became one of about 75 young athletes who die every year of sudden cardiac death. Of those, about a third are caused by a heart condition called hypertrophic cardiomyopathy, a genetic condition where during the teenage years the heart begins to thicken abnormally.
One of the syndromes would be the susceptibility to have an arrhythmia when they exercise. So a child could have a thickened heart, not know about the condition, and then while they're playing sports, while they're on the basketball field, their heart could suddenly race and they could die. This valve over here is the mitral valve.
According to Dr. Keith Mankiewicz, Washington University cardiologist at Barnes-Jewish Hospital and Barnes-Jewish West County Hospital, many parents and children don't recognize symptoms or simply disregard them. The symptoms are shortness of breath, chest discomfort, rapid heartbeats, or passing out.
I think that most young kids think that they're healthy, and when they do develop shortness of breath related to a sporting event, they probably think they're just out of shape. But I think we need to create an awareness that if they're more short of breath than they should be, then they should be evaluated further.
He says that can be done by educating parents, students, physicians, and coaches to not only be aware of symptoms young athletes complain about, but to let the young athlete know they may have to turn to different, less exerting sports.
It's extremely difficult for some kids who their lives revolve around sports to tell them that they are not allowed to exert themselves. And there are some kids who listen to our advice, and there are some kids who ignore our advice. But we need the child, the parent, and the school to be aware that they have a potentially dangerous condition, and that the guidelines set out by the American Heart Association is that they should not exert themselves.
As a parent, I think the biggest misconception is that my child is healthy. Parents need to realize that this is happening to seemingly healthy teenagers.
Both Stahlschmidt and Dr. Mankiewicz agree schools should not only have external defibrillators, but also be trained in how to use them.
Take a deep breath.
In addition, schools should use annual physical exams endorsed by the American Heart Association.
Most schools don't have an awareness of the risks that athletes are at, and I would stress that it's extremely important for every school to have some kind of program where they have an awareness that one of the athletes could die during exercise. And if we look at the potential risks for kids dying, there's at least 75 children who die every year. And every school is potentially at risk for one of their pupils dying on the sports field. And they should do everything they can to prevent a catastrophe from happening.
It's not always about winning. It's about these kids living long, healthy lives.
Dr. Mankiewicz has a special clinic devoted to young athletes. For more information,
also when you have HCM, you can develop mitral problems or mitral valve problems, which is called mitral regurgitation, and that's when the blood from your left atrium goes into your left ventricle. Your left ventricle, and then your valve can't close properly, so then it backtracks back into the atrium, and that causes lumbar problems. Also, 1 out of every 500 people are affected by this disease. That's 0.2% of the population, or 544,000 people in the U.S. So what causes hypertrophic cardiomyopathy? Well, it is a commonly inherited disease, and it's caused by an abnormality in a gene that codes the characteristics for the heart muscle. Also, if you have this, you're going to have abnormal arrangement of heart muscle fibers. There are a lot of genes that can cause this. So it's because there's so many, it's difficult to identify who has it and who doesn't. And if your parents have it, you have a 50% chance that you're gonna have it. Yeah. Also, I didn't write it on here, but HCM is a autosomal dominant disease, which means that only one dominant allele has to be present in the gene for you to have the defect. Oh, and I guess I can tell you guys this one, but some of the mutations with these genes are mainly, they're associated to be with sudden death more than any other, which